Madison County Live. And good news is brought to you by these great sponsors. Thanks for joining us. I'm with Nurse Extraordinaire Ava Wright with the Madison County Health Department. Welcome.
Thank you. It's good to be here.
It's good to have you. Now, we've got some stuff to talk about. The first thing coming up, Nurses Day.
Yes. It's always exciting.
Isn't that exciting?
Yes, it is.
Or do they call it the whole week now?
Well, now it's a week.
See, a week. See, I think it needs to be Nurses Month.
Yeah, maybe Nurses Year. Who knows?
And when is that, Ava?
Well, it's next week.
Okay.
It's May 6th through the 12th.
Oh, good. Perfect.
So it's coming right up.
Okay.
And Nurses Day is officially May the 6th.
May the 6th is the official day? Okay.
Yes.
Okay.
And so it's just a great time to honor the nurses in your life and also to maybe consider nursing as a career.
Yes. I don't know if anyone's heard, but yes, we need nurses.
Yes, we need nurses.
Right.
And there are just so many ways that you can work as a nurse, so it's very versatile. So that makes it even more exciting.
I want to take this opportunity to thank you as a nurse, and of course all the nurses down at the Madison County Health Department, as well as nurses and nurse practitioners in my family, like my wife, my sister, my daughter. So nurses are so important. And speaking of which, you have a very special quote. Would she be considered the first nurse or the first quotable nurse?
I think that she, as in Florence Nightingale, is the pioneer of modern nursing.
She is.
So she's one of my favorites.
Right.
And so one of my very favorite quotes, and you would think I have it memorized, but back in the day they talked a little differently, so it doesn't come out quite like we would say it now.
True.
But it is. I think one's feelings waste themselves in words. They ought all be distilled into actions which bring results. And I think that just sums up nursing.
That's a great quote.
Yeah.
And if anyone knows personal experience with nurses, I think that describes them to a T.
I do too. And I just think that's the way it should be, not just for nurses, but all of us in the community.
The whole team, especially the last 3 years, everyone coming together during this pandemic and this whole situation.
It has for sure been a group effort throughout the county, throughout the United States, the state, and nurses are a big part of that.
That's right.
But without the support of others, and then
you have support staff, you have everybody that works at hospitals, you have everybody that runs and does things for hospitals. Yes. I mean, there's a whole collective agreement between everyone.
Nurses, but it's all everybody. It's collaboration.
Right.
And then I also have to give a shout out to school nurses because that's part of my background.
Right. Yeah.
They're everywhere, actually. Nurses are everywhere.
Right. And speaking of the county, they did a proclamation.
They did.
And I know that the Madison County Health Department, in part with the Madison County county government, also with Judge Taylor, they had a proclamation. Do you want to read that special line?
Yeah, I thought it was a great line. Yes, it was a great line, and we were so honored to be a part of that as Madison County Health Department, but it included all nurses in the county, and I think it's great. What he said in this proclamation, and it's for May 6th, now, therefore, I, Reagan Taylor, Madison County Judge Executive in the Madison County Fiscal Court, do hereby proclaim May 6, 2022 as National Nurses Day and urge citizens to honor all nurses for their dedication and service to keeping the people in our communities healthy.
Yeah, absolutely. And I know in your family, my family, we all know this to be true. If there's an issue or a health issue, who gets the first phone call? Nurses.
The nurse, of course.
The nurse and the family.
And we do love it.
Exactly.
We love it. It's an honor.
Who do they call? Bam, I'm going to call, I know Ava, she's a nurse. I mean, you get it all the time.
It's really just, it's an honor that they would want to trust us.
It is true.
Nursing is one of the most trusted professions. There's been surveys and discussions about that. Nurses are very trusting, and they're advocates for the patient and for the families and for the healthcare team.
Well, I know any issue I have, I always look over at my wife and I go, should I do this? Is this what I should do? And she goes, I would if I were you. Yeah. You know what I'm saying? So that's good enough for me.
Right.
Because it's a healthcare profession.
It is.
And you should listen. You should listen to the healthcare professionals. It's just simple advice I like to follow.
Sometimes it's difficult though when it's a family member.
Oh, I know.
And of course nurses sometimes can be guilty of not taking care of themselves.
Sure. Oh, sure.
Taking care of everybody.
Because they're taking care of other people, and that is also a trait.
Yes,
Yep,
it is.
yep.
And I would say to all the nurses out there, take care of yourself.
Yes, please.
Take some time for yourself. It's been a rough 2-3 years.
It has.
It has for everybody, nurses and others. But just to, put your feet up, take care of yourself. Take a day
Please.
off.
Yes, absolutely. Take a week
Take a
off.
week off,
when
yeah.
you can. Absolutely.
Right.
And you mentioned an interesting statistic here in Madison County. How many nurses per individual?
There's probably at least one nurse for every 90,
Wow.
90 residents in the
Right,
county. There's
right.
probably more.
There's probably more
There's
because
at least 1,000 nurses
that you
in our
quoted
county.
was a while
Yes,
back.
yeah.
So there's probably more than that now.
I did look at statistics, and we have a lot of nurse practitioners.
Sure.
And so that's awesome.
So we're pretty-
And speaking of nurse practitioners,
Yes.
you've got one. right there.
Exactly.
Yeah.
Emily, congratulations. She's a nurse
Yeah.
practitioner now, as well as my sister. She's a nurse practitioner. But everybody went up through the ranks. And like you said, we need more nurses and nurse practitioners. That's a
Yes.
fact.
And it's awesome too at the health department. Our nursing team works with EKU.
That's right. That's right.
And Berea College, and we love to have clinicals there. And the nursing students help out our community a lot. They've helped recently with the pandemic and giving vaccines
Right.
and educating our community. So
And I think a lot of people don't know. Just call the health department. They'll answer your question.
call us. Yeah.
Yeah, I mean, it's right there, 623-7312.
That's right. And we're there to serve you.
That's
We've
right.
got plenty of services, nurse-led services. We do
Right.
have a medical director who is a physician, but
Right.
we have immunizations, TB skin test assessments.
All that great stuff. It's right
WIC,
there.
our WIC families,
Yep.
our HANDS,
Yeah,
which
HANDS
you hosted
program, right.
recently.
Absolutely.
We have RNs and nurses that are in those programs. We also provide screenings for STDs, and we're available for any reportable disease. Actually,
Sure.
we've had
Right.
COVID, but there are other
There are
reportable diseases
other
out
issues,
there.
right. Absolutely.
Yeah.
Right.
And currently, our interim public health director is Lloyd Jordison, and he
I
is
love Lloyd,
an
yeah.
RN. He's a nurse. So
Is he a nurse?
He is a nurse.
I don't think I think I knew that in the back of my head.
Yeah,
Hey, thank
he's a
you,
great
Lloyd.
nurse.
Yeah.
He's
Great.
awesome.
Oh, that's
So,
cool. My
yeah.
wife loves Lloyd.
Yeah, he's out there for the community,
That's
as
great.
all of us.
Sure. Speaking of which, we're talking about health. Let's talk about boosters.
Okay,
You can get those down there, right?
we can give you a booster.
Absolutely.
And there is some new guidance out.
Mm-hmm.
I'm not saying that I am, but if you're over 50,
I got mine.
you need your booster. You
Right.
do.
Yeah, you do. Right.
And I might be too. I mean, you probably can tell, but
No,
I try not to admit it.
She's not that way yet.
And then,
You got some time.
Yeah, and then of course, if you have an
Right.
immunocompromised condition,
Yeah, absolutely.
also you can
Right.
receive your second booster. So
Sure.
we're boosting and boosting.
Yeah, I mean, and it's easy to do. I didn't mind. Walked in. I mean, it was easy. I mean,
It
didn't
is
wait any time.
easy, and
Right.
if you're having trouble, just give us a call, and we'll get you in. We'll also be able to send you to other facilities. Maybe you want
Sure.
a Pfizer vaccine.
Sure,
You're
yeah.
offering Moderna, so
Sure,
we will
right.
help get you where you need to be.
If you're over 50, get your booster.
Yes, please, and tell your loved ones.
Absolutely, that's right. For more information about everything you all do at Madison County Health Department, visit the website, right?
Yes.
And that is Madison County Health. DEPT.org. Okay, good. All
Yeah.
right, excellent. And then, of course, 623-7312.
Yes.
Berea and Richmond locations.
Yes, and also make sure you dial the area code because our new
I know.
system. We've had a lot of people calling
Well,
and are trying to call and they're
On
like,
your cell
phone's not
phone,
working."
it will tell you this number is no longer, and you forget, now you have to dial the area
Yeah,
code.
so don't
for all
forget
the
that
numbers.
part.
That's right.
Yes.
All right. Did we get everything?
I think we did.
I think we did.
I'm
Thank
really
you.
excited. Thanks for supporting the health
Yeah.
department and all
Absolutely.
nurses, and we're here for you. We support you as well.
Absolutely. Folks, more information, just like Ava said, go to the website, call that number. Thanks for watching.
Yes.